Good morning and good afternoon to all the dear colleagues and dear participants. I wish you very warm welcome to the second webinar in the series of Future-Proofing Child and Adolescent Health in Europe and Central Asia that is accompanying the process of development of the new regional strategy for child and adolescent health and well-being. My name is Alexandra Jovic. I'm Early Childhood Development Specialist in UNICEF Regional Office for Europe and Central Asia, and I will be your facilitator today. And as you already know, this webinar is organized by UNICEF Regional Office for Europe and Central Asia, WHO Regional Office for Europe, and the International Step by Step Association under the auspices of the Health System for ECD initiative. As usual, we will continue this webinar in English, and we have simultaneous translation available in Russian that you can choose at the bottom of your screens and the little globe and continue hearing in the language that suits you better. With that, I invite Gabriele Fontana, Regional Health Advisor in UNICEF Regional Office for Europe and Central Asia, to open the webinar and greet you on behalf of UNICEF and WHO. Over to you, Gabriele.
Thank you so much, Alex. Please nod to confirm that you can hear me. Perfect. Colleagues, it's a pleasure to be here. I see the number of participants we just started and is already quite high. So I want to welcome everybody to the call, and especially the colleagues from WHO, Joao, Sophie, Suzanne, and the other colleagues that we're working with for the realization of this webinar, but also on the content of this specific edition of the webinar, that is our regional strategy for child and adolescent health and well-being. And I want to, in particular, acknowledge the importance of the strategy. This is the second webinar on this series. I think on the 17th of June, we introduced the evidence that we use to develop this strategy. And it has been a long journey. A regional strategy is not developed overnight and is not developed only by WHO and UNICEF behind closed doors. This is the result of a lot of interaction of member states being in the lead, of inputs from young people, from colleagues in academia, colleagues in professional associations, and we thank them all for working very hard over the last year and a half to bring us to where we are at, with the strategy that will be presented and endorsed in October by member states at the Regional Committee of WHO, and that not only covers the health and nutrition priorities that we have in the region, looking at childhood development, looking at immunization, looking at mental health for adolescents, but it also looks at the challenges that health systems are facing in terms of prioritization, financial resources, capacity, availability of human resources, information systems, to support the efforts in place to secure that every child and every adolescent has access to all the promotion, prevention, and curative services that they might need. And even beyond that, the strategy has a very strong focus on multisectorality, on how we can work to improve health and well-being of children and adolescents through schools, through social services, through digital platforms, and so on. I will not go in further detail because that's what we're going to do in the next 90 minutes. And even beyond that, because again, the strategy builds on what has been done so far. We'll have two countries today that will share with us some of their good practices. We've been inspired by many successful programs already supporting child and adolescent health in countries, and this will provide an example of good practices that we reflected in the strategy, and we hope that will be picked up and applied across the whole region. UNICEF and WHO remain committed to support the strategy implementation jointly. We have been collaborating very closely. You will see that every document, including the strategy, but the fact sheets, they will have country profiles coming up that will help us to monitor progress, etc. All has been co-branded because it's the result of a very close collaboration of the two teams to be able to support you in the best way possible. And let me close it there because we have a lot to go through and very interesting things to explore during the next hour and a half. Thank you so much.
Thank you so much, Gabriele, for these encouraging words at the beginning, celebrating all the work has passed and creating an excellent entry for the next presentation, for which I'm inviting Sophie Julien, Technical Officer for Child and Adolescent Health from the WHO Regional Office for Europe, who will present the key elements of the draft strategy as well as the process of its development. Over to you, Sophie.
Thank you very much, and good morning, good afternoon, colleagues. So no need to present myself again. I'm Sophie. I'm working for the regional office, as Alex just mentioned, based in the Athens Quality of Care and Patient Safety Office. And I would like to start, if you can put that in the presentation mode, Jen, please, that would be lovely. And I would like to start the presentation of the strategy that Gabriel has introduced, A Healthy Start for a Healthy Life. And this title was actually chosen by the member states throughout the consultations that we had. I can see the mode. Yeah, you will have to change. So as we are waiting the slides to be fixed, yes, perfect. And I don't know if you can put. Yeah, so I will start going through the content, and I'm sure that the slides will appear in a second. I would like to start saying that Europe and Central Asia are failing their children. So we have presented the main challenges faced by children and adolescents in the region through our fact sheets that Gabriele just mentioned in the previous webinar. And you have in the chat the link if you have missed it. We have heard about hard-earned reductions in child mortality in the region that are reversing or stagnating. We heard about rates of breastfeeding reductions in the first hour of life, while overweight and obesity rates are high, leading to long-term consequences. We have heard about the immunization coverage that is decreasing, the use of e-cigarettes that is increasing, mental health issues, digital risks. So the impact of these failures will be felt for the decades to come. If I can have the next slide, please. So earlier this year, the two regional directors from WHO and UNICEF published a joint letter in the Lancet that you can access through scanning this QR code, calling for renewed focus on children and adolescent health and well-being, calling governments, civil society, international bodies to work toward a sustainable and healthy future for all. Next slide, please. And so this renewed focus on children and adolescents was marked by the side event on the regional committee that we had last year. But already before this side event, and since then, WHO and UNICEF has been working together very closely in the development of the strategy. And as Gabriele mentioned, I will be presenting on behalf of the whole team. Next slide, please. So how did we start it? First, we have mapped the key issues of concern faced by children and adolescents in the region. I will be brief on this one because these are the ones that presented through the previous webinar. And so we did that through different sources of data, including mainly the survey that was conducting to member states at the end of the previous child and adolescent health strategy, but also from a more recent survey that was circulated in which we ask member states, child health professionals, and also adolescents themselves to rate from 1 to 5 a list of statements according to their priority in their particular context. And so we ended up with these key issues of concern to really tackle in this strategy, those that you can see in these colored tiles on these slides. Next slide, please. So we have developed a framework with 5 priority action areas in order to address these key issues of concern towards the vision that all children and adolescents realize their rights to physical, mental, and social health and well-being. So this strategy not only builds on our past effort, but also ensures that equity and the rights of every child is as enshrined in the UN Convention and central to the SDG, the Sustainable Developmental Goals, are at the heart of our collective actions, offering member states clear and actionable steps to fulfill these very important commitments. So these are the 5 areas that you can see on the slides. This is about investing early and strategically in children and adolescent health. This is about providing equitable, high-quality care to all children and adolescents. It's about regulating about commercial harms, and it's about providing and fostering multi-sectoral engagements for national policies. So for each of these areas that are then overarched by the 5th one that I haven't mentioned, which is the monitoring progress for accountability, we have the strategy proposes concrete actions to tackle these region-specific causes of mortality and morbidity, and to drive improved health outcomes for children and adolescents. So in the next 5 slides, I will unpack a bit each of these areas to show you what are the main actions suggested by the strategy. So next slide, please. So I said investing strategically in child and adolescent health and well-being for long-term benefits. Indeed, this sets the foundation for healthy aging. It reduces the burden of non-communicable disease, leading altogether to substantial health and economic advancements. So what are the specific actions suggested for member states? It's about working towards achieving sufficient levels of public spending on child and adolescent health and well-being by all sectors. We also need to invest in the workforce that is fit for children and adolescents in all the domains. We need to increase the multi-sectoral investment in areas that promote children and adolescent health and well-being, including health-promoting schools, parenting program, healthy cities, so that we have a comprehensive approach. And we need finally to invest in emerging challenges that you are all aware about, artificial intelligence, digital health, climate change, just to start the list. Next slide, please. I'm here presenting the actions for member states, and I will then go to the actions for WHO and UNICEF. So from this second main area for actions, as I mentioned, it's delivering comprehensive and equitable high-quality healthcare that is specific to the needs of children and adolescents. As we know, access to quality healthcare needs to be without financial hardship. So what are the proposed actions? So it's about strengthening primary healthcare, but also the referral and the collaboration with the specialist services and improving long-term and rehabilitative services. The second action is about the development and the update and implementation of national quality standards for children and adolescents in all the different domains that are aligned with international WHO and UNICEF guidelines. So this includes the standard for the use of antibiotics, vaccination, breastfeeding, primary health care, mental health, early childhood development, long-term care, preventing violence against children and adolescents, and transition to adult health services. Next slide, please. Regulating. This is a very emerging challenges that we have with the social media and influencers. So it's about regulating against the harmful effects of the commercial goods and services. We know that these marketing strategies can significantly influence the behaviors and pose significant health risks to the child and adolescent health nowadays. So what are the actions proposed in the strategy. We have 5 here: comprehensive regulatory policies and legislation to restrict the marketing of foods high in fat, salt, and sugar. It's about mandate the provision of healthy meals in schools, but also in preschools. It's about implementing the International Code of Marketing of Breast Milk Substitutes and to follow up on these implementations. It's about implementation and to enforce the measures to protect children and adolescents from nicotine, tobacco, and alcohol consumption. And it's about the implementation of national policies to protect children from the digital harm. Next slide, please. But we need to move beyond the health sector. We need to foster a multi-sectoral approach so that we can comprehensively develop child and adolescent health policies. So we all know that child and health outcomes are determined by all the other sectors beyond health, including education, sport, sanitation, nutrition, urban planning, transport, and social welfare. So the specific actions here are about policies and mechanisms that are across the ministry units to ensure this multi-sectoral coordination on the implementation and budgeting of all these measures that are included in the strategy. We need health promoting schools. We need to make sure that every school in the health promoting school, and we need to implement the preschool approach as well. Health personnel are present or connected in schools. It's also another measure that need to be made possible and feasible. We need to foster the social connectedness among adolescents and to work on improving the health literacy for parents and caregivers, and obviously for adolescents, which is included in another section. And the next slide will lead us to the 5th action areas, which is about monitoring progress for accountability. We need to address the data gaps, and we need to ensure that we can enable measurement and monitoring of progress. Without data, we cannot monitor progress. So the 3 main actions are about strengthening the national health surveillance infrastructure. We all know the overload of the countries to report on data. So it is crucial that we use existing international data collection mechanisms, and those include the Health Behavioral School in Children Survey, the HBSC, but also the GYTS, the COSI on obesity, just to list a few. And lastly, the monitoring of a limited set of indicators that we will work with countries to be agreed with countries in the context of the strategy, to be monitored by the midterms and by the end line of the strategy. Next slide, please. In this summary slide, I just would like to also bring light of the main actions that WHO and UNICEF will be supporting the member states across these priority areas. 1, to support the country through advocacy, but also technical assistance and capacity building, with a particular focus in low resource and conflict affected settings where the support is most needed. High and comprehensive quality care, so about assisting countries in adapting and implementing the evidence-based guidelines and framework that we have been mentioning, and in capacity to deliver integrated and person-centered care across the life course. For regulations, WHO and UNICEF will provide model legislation, regulatory toolkits, and platform for sharing best practices across member states. And we actually start doing that to date in the second part of this webinar. This is having these platforms to be able to share best practices is really something that we have been requested by member states on different occasions. For the multi-sectoral engagements, it's about assisting in operationalizing these multi-sectoral strategies, about supporting the implementation of the global standards and facilitating, again, this knowledge exchange across the region. And finally, in the monitoring area, we will be supporting countries in building the digital infrastructure, in developing this unified monitoring framework, and also in establishing a regional youth advisory board to ensure the youth participation in strategic reviews and in all the points of the implementation. Next slide, please. So all these actions have been a summary, and with this slide, I also would like to highlight what Gabriele mentioned at the beginning of this webinar. This strategy was not developed overnight, and this strategy was not developed by WHO and UNICEF in closed doors. So this process has taken a long time. We have actually started already in 2019, before the end of the previous Children and Adolescent Health Strategy. The youth participation, and I will get into that in a couple of slides, has been key in all the steps since the very beginning. And we had an extensive member state consultation also through all the steps. I want to finish these slides by mentioning that we have presented this strategy in the Social Committee for the Regional Committee for WHO, so that we are well on track for the adoption of the strategy in October this year. Next slide, please. I want to zoom very briefly in a couple of points of this process. So, but these extensive member states consultations, we've been co-developing this strategy with them. You can see here on this slide in the first member state consultation, and those are the last 3 member state consultations over the last 9 months. 30 member states participated online. We had 40 participative countries that you can see in the pictures in the hybrid Istanbul consultation, and 34 in the last online consultation. The priority survey that I mentioned at the very beginning of this presentation has been completed by 39 out of our 53 member states, and we received an extensive written feedback from 27 member states. We also are very grateful to the advisory group who has been actively working in the writing and shaping the strategy. And this advisory group was composed of 5 countries: Spain, Portugal, Russia, Armenia, and Croatia. In the next slide, I want to highlight the children and adolescent participations. We cannot have a strategy for children and adolescents without children and adolescents. So we'll not go into very much details. We'll have the slides at the end of the webinar. But since the very beginning, you can see that a very big amount of adolescents have participated in shaping the different steps of the strategy, from participatory workshops, from participating into surveys, and to raising focus groups in which we had a couple of adolescents participating to our last member states consultation. And with that, I would like to the next slide to thank you all. We will be as a team very happy to reply to any questions, and I will hand over to you, dear Alex.
Thanks a lot, Sophie, for the great presentation. And I hope that our dear participants understand it was not possible to include and present all the details of the strategy that is much more comprehensive that could fit on the slides. But as Sophie is saying, we are closing the moment of its adoption in October, when it will be widely disseminated with everyone. But in the next part, we still wanted to give you an opportunity to quickly reflect on these key strategic priorities that Sophie shared, and see and respond from your perspective and perspective of the context and the country that you are coming from, in what are your priorities? How do you see the ranking of the priorities that Sophie just presented? So we would kindly ask you to log into the Mentimeter, and Jen will share the Mentimeter login details immediately, so that you can scan the QR code with your phone, and you will be in the Mentimeter, and then use the code number that you see on the screen. We have only 4 questions for you. It will be a very quick exercise, but given that you are coming from, many countries of the region, we have also seen in consultations and through the survey for member states, professionals, and children, we had 45 different priorities that we asked them ahead of the strategy development, and we saw that there was no one item that was left empty. So different countries, of course, prioritize different things and rank them, And that's why it will be really interesting to see what are your reflections. So Jen, you will let me know if you can see on the other side how many people have logged in. And when we have a decent number, we encourage you. It will be a very short reflection, but it makes you be part of the exercise as well. So the first strategic area of the strategy is investing strategically in child and adolescent health and well-being for long-term benefits. So in the next slide, you will be able to see, these 4 different areas that we've kindly asked you to reflect on and put them in the order of priority as you see them. So you can drag and drop these things with your cursor on your phone or computer. And as you are doing that, we will see how it moves. And we will immediately see what are the priorities that as reflected by you. So of course, the sufficient levels of public spending. The link is, we have to Dr. Ronit. The QR code was on the screen. But if you also join mentimeter.com, I don't know if we can paste the QR code in the chat. So sufficient levels of public spending, of course, together with the multi-sector investment, acknowledging that it is not only the health sector that should invest, coming as 2 main priorities, followed by workforce and investing in research to identify new emerging child and adolescent health related areas. And we can move to the next one. Thanks a lot for voting. The second one relates to the high quality care. And we can immediately move to the next slide, Jen, in which you will see these 4 areas in which we really try to, kind of merge different recommendations and suggested actions for the member states. So you will see implement national quality standards for child and adolescent health, focused on key areas of use of antibiotics, vaccination, breastfeeding, strengthen primary healthcare, referral and collaboration, adapt evidence-based strategies to prevent and end violence against children, adapt and implement the nurturing care framework version for Europe. So again, the same exercise. You can drag and drop and tell us what is the most important. In your country, at least. And we see that primary health care, referral and collaboration with specialist services and long-term and rehabilitative services are winning in this one. We believe really that all of these are equally important, but thank you for reflecting and letting us know what you think. And we can move to the next one, number 3, that is about regulating against harmful effects of commercial goods and services. And again, we can move to the next slide where you will see that we have comprehensive regulatory policies and legislation to restrict the marketing of foods high in salt, fat, and sugar, provision of healthy meals in preschools and schools, international code, measures to protect from nicotine, tobacco, and alcohol, and national policies to protect children from digital harm. And digital harm quickly moves to the top. We see that really these are the priorities that are taking more and more attention in social media, in public, in professional circles, and we hope that strategy and adaptation of the strategy across countries will help address. With the little changes now, tobacco, nicotine, alcohol consumption. Every vote is changing the order as well. And Thanks a lot for sharing reflections there. We have one more question that is on the multi-sectoral engagement. And multi-sectoral engagement is an important part of the strategy, reflecting that many sectors need to collaborate and come together to enable comprehensive support for child and adolescent health through policies and mechanisms for coordination, through health promoting schools and preschools, through health personnel that will be connected with schools or available there, through fostering social connectedness among adolescents and improving health literacy for parents and caregivers. So again, the floor is yours, and let us know how it ranks for you. We've heard through the consultation process in development of the strategy on the importance of bringing different ministries and institutions together. And I see that these cross-ministry coordination mechanisms are highly ranked. And we hope that we will continue with exchanges among countries and sharing good examples so that everyone can learn from what works in managing to establish this coordination. Thanks a lot for all the reflections. And I hope that it helped you as well to remember some of the elements of the strategy. Thanks a lot. I think, Jen, we can move on from the Mentimeter into the next part of the webinar that I would believe is really the most interesting, because while we wait adoption of the strategy in October, we wanted to inspire you by sharing some of the examples of programs and services that are already successfully supporting health and well-being on children and adolescents.
Dear Alex, if I may, we have two hands up. I don't know if you would like to give them an opportunity now or later.
Oh, please,
at the end of the webinar.
We have time, and please go ahead. I don't see them on my screen, but whoever has the hands up, please go ahead.
So we have Martina that appears first in my screen.
Martina, would you like to come in?
Our hand is Dafina.
Okay.
I think maybe that you need to give them access to actually unmute themselves. Is that?
No, they unmute. They can unmute. They can come in. They are not automatically muted. So, colleagues, did you want to ask, or that was by mistake? We will also have some time for reflections and discussion as we go. So you can put your question in the chat. We continue and we come back to you. Oh, I see now, Dafina Muchai. Dafina, would you like to come in? Can you hear us? Because we can't hear you. Okay. So Dafina, please put your question in the chat. We'll come back to it. And we move to the, oh yes, I didn't raise my hand, so it was by mistake. It is visible as that, but no problem. And we move on with the country examples and presentations. Please be free to put your questions in the chat as we go. We'll try to respond to them as well in the chat or during the discussion part, because we have planned time for that.
Alex, Dr.
Yes?
Oni Diakobovic requests if you can show the results of the last Mentimeter question, please. I don't know if we can pull it up. Otherwise, we have to refer to the recording maybe.
Yes, we can. We have that results saved, so we can try to share as well in the materials that we will post with the materials to the webinar. Please subscribe to the newsletter that you see in the chat. So then we will also forward all the materials to your email, but also you will be able to go to the platform and at any point see all the materials. with that, I think that we move to the first country. Today we have 2 countries with us, and we wanted them to share the examples of programs and services to inspire us all. The presenters we have are from Portugal and Moldova, and the first one comes from Portugal, will be presented by Dr. Cecilia Elias from the Portuguese Health Directorate General from the Division of Sexual, Reproductive, Infant and Child Health. Dr. Elias is also national focal point for the new child and adolescent strategy, and will tell us more about the implementation of the National Child and Adolescent Health Program in Portugal, with a focus on the young children and links with early childhood intervention. So Cecilia, thanks a lot for being with us, and we will upload your presentation to the screen. The floor is yours.
Thank you very much, Alexandra, and thank you so much for the invitation to present the National Child and Adolescent Health Program in Portugal, with a focus on the links to early childhood intervention. So next slide, please. So the Portuguese Child and Adolescent Health Program is a comprehensive national structural program designed to promote the well-being, development, and health of children and adolescents across all stages of growth. And its core principle is health promotion and disease prevention, with a strong focus on early intervention and family involvement. So it is as I said, a structural program from ages, which includes children and adolescents from ages 0 to 17. It was, the last updated was in 2013. So we are currently on the initial phase of reviewing and aiming for the program to have a broader scope, and is very family and youth oriented. In this picture, you can see the normative, so the technical standard for the program as it's published today. Next slide, please. So one of the key components of the program is the calendarization of health consultation at critical development ages. So these consultations are aligned with key life events such as motor, emotional, cognitive, social development, as well as nutrition and schooling, which ensures that the healthcare is tailored to the needs of the stage of life, and issues can be detected early and addressed early. The major strength, and another major strength of the program, is the scheduling is consistent with the national vaccination program, which means the consultations are synchronized with a vaccination schedule, making easier for families by reducing the number of visits that are required, making it more efficient. In particularly in today's context with anti-vaccination movement growth, reinforcing vaccination coverage is seen as a public health priority to protect the individual and the community health. So the program also values anticipatory care, which means that preparing families and caregivers for challenges, as well as children and adolescents, surely, for the upcoming challenges. So parents are provided guidance and education that empowers them to play an active role in promoting their child's health and responding to new social and health challenges, such as mental health, screen use, and lifestyle habits, as with children and adolescents. Another major priority is the prevention of emotional and behavior disorders by investing in early mental health support. The program helps reduce long-term social and psychological problems, and it promotes the progressive autonomy of children and adolescents, increasing responsibility as they grow older. And also importantly is the recognition that health issues, particularly and even more complex health issues, require collaborative and interdisciplinary responses. And so the program promotes team-based care and the coordination between sectors. Next slide, please. So as I previously said, the Portuguese Child and Adolescent Health Program, the consultations are strategically scheduled with key age milestones to support the child's physical, cognitive, emotional, and social development. And this age-specific distribution ensures that children receive the right care at the right time. So the consultations start shortly after birth, and they are continuously, or they are scattered throughout childhood and youth, with several outpatient appointments in the first year, in the second year, and then throughout adolescence. The program is very focused on the early years and not so significantly focused on adolescence. So it is structured to the distribution aligns with developmental needs and ensures the continuity of care, early detection of problems, and timely health education for both children and families. And we are currently reviewing, as I said, and given we will probably add an extra consultation at adolescents to give further continuity at these ages, and recognizing the challenges that are increasing at this ages, so that we can provide greater responses and address needs that have been highlighted. Next slide, please. So in the child and health youth consultations, a variety of interventions are carried out. If you want to maybe click them all, so everything, yeah, thank you very much. In the child and adolescent youth consultations, a variety of interventions are carried out to address the physical, emotional, cognitive, and social dimensions of child development. And these interventions aim to achieve a wide range of objectives, with the overarching goal of continuously improving the health outcomes across the pediatric population. So health professionals address development progress, monitor risk factors, and implement preventative measures tailored for the child's age and needs, and these actions support early detection of potential health issues with appropriate responses. And all the data collected from consultations is systematically recorded in standardized tools. This includes a physical documentation, which is the Child and Youth Health Bulletin, you can see on the left photo, and a digital registration in the e-bulletin, which is on the right, which is integrated into the National Health Information System. So it's applicable to both either the paper version or the digital version are both applicable to the public and private sectors. And in Portugal, the private sector has grown significantly in the last 10 years. So information is interconnected in the health system and not just in the public sector. So with this data, we can ensure or try to maximize the continuity of care. So, and this facilitates communication among professionals and contributes to the evaluation and planning of child health policies and services at a national level. So I'm just going through some of the points that are reviewed in these outpatient clinics, such as the physical examination. Closely linked to it is the early development monitoring, which includes tracking milestones in speech, movement, social integration, and allows for a timely referral, which I'll speak very briefly in another slide. So another fundamental component is screening. So not just the physical screening, but also family and social risk factors, trying to identify vulnerabilities in the home environment. And so professionals can offer support and refer to appropriate services. The program also addresses addiction, including tobacco, alcohol, and screens. And this is one of the areas which will be extensively reviewed in the next program. Education and open conversations at the right age to prevent behaviors even before they begin. So a bit of literacy, as the Mentimeter showed. So accident prevention is another priority in children, where professionals counsel parents in child-proofing their home, safe transport, among others. Equally important is addressing emotions and behavior, as well as encouraging healthy lifestyles with sleep, physical activity, and balanced nutrition, as well as how to promote leisure time, healthy leisure time, with prioritizing play, creativity, and outdoor activities. And this is in a counseling perspective, during all consultations in a progressive manner as the child grows older. If you want to click again, please, there's still a bit more on that slide. And when specific needs are identified during a routine consultation, referrals play a crucial role in ensuring the timely and appropriate support. So children with complex or persistent medical conditions may be referred to specialty care. When development delays and disabilities are detected, referrals to early intervention teams allow for a coordinated multidisciplinary response that includes several actors. And additionally, school health teams are also engaged when there are concerns regarding the impact on learning, behavior, and school integration. So these pathways, these referral pathways, ensure continuity of care and reflect the emphasis on early detection, multidisciplinary collaboration, and child-centered care. And so, next slide, please. So in this slide, we can see the information, the interface for the information system. And in particular, if you want to press again, please, you can see there is a specific development folder for, we use the Mary Sheridan. So that is the folder that we access, and these are all the variables that are collected in the outpatient clinics according to age. So gives a very important and interesting temporal time scale on the analytical variables and how we progress or assess the child or adolescents. Next slide, please. And continuing on the early intervention actions. So there are folders specifically for the Mary Sheridan tests. And for instance, at 9 months, we measure, and these variables are introduced in the information system. So, and we measure behavior and social adaptation, vision and fine motricity, posture and global motricity, and hearing and language. If you want to go to the next slide, please. And again. And again. That's fine. There's 2 more, I think. That's fine. If you want to press 2 more times, that'd be lovely. Thank you very much. And so there's also, so on the top left, you can see the alarm signs for a referral. So for warning signs to refer children to our early intervention teams. And you've also got the historic. So all the examinations and all the information that's been collected is easily accessible. And so, and why do we use this tool instead of a less formal way of evaluating early development? Well, because scientific data shows that isolated clinical assessments are less specific and less the techniques do not diagnose as many children. So, so these standardized screening instruments have a sensitivity and specificity between 70 and 90%. And so in Portugal, this has been an ongoing effort to diagnose and refer children with who require early intervention for the last years. Next slide, please. And again. And so there is a specific folder for referrals to the SNP team. And so SNP is our early intervention system, which in the same information system, you can then, when evaluating a child with a Mary Sheridan, you didn't find that and referral needs to be made, you would then open the SNP folder and refer the child to the local teams. Next slide, please. And so what is our national early intervention system? So our national early intervention system is a coordinated network of services They are designed to support the development of children from birth to 6 years of age, especially those who are at risk of experiencing or who have development delays. It operates under the joint responsibility of three ministries: the health, the labor and security and social security, and education. And the system focuses not only on the child's physical, cognitive, and emotional development, but provides a comprehensive support to families, recognizing their role in the child's growth. The services are tailored to the individual needs of each child and family. If you want to go to the next slide. So, and this is a report from the 2023 activity from the National Early Intervention System in Childhood in Portugal, highlighting the work of local intervention teams and the collaboration between these three ministries, as I said, which shows that, so in 2023, approximately 28,000 children and their families were supported through the local intervention teams, which are 155 local teams. And so there is a significant asymmetry in the resources allocated from a regional point of view, and even on the effectiveness, I would say, of this of the intervention system, which is also reflection, I think, of the needs from a regional need. But so from the main results, if you want to go to the next slide, we see that there's been an increasing number of children served as the years increase. So, and this report highlights that there's also an expansion of the local intervention teams. They have been reinforced and they have and so they have been reinforced by the three ministries, so the health, education, and social services. And so there's been a push to promote good practices towards awareness and training, and to identify challenges. Next slide, please. So this is me almost finishing. I'm sorry if I took extra time with this presentation. So my key takeaways are that Portugal links health surveillance with early intervention, that there's institutional commitment through law and national guidelines toward child health and early intervention, that early investment supports child development and family empowerment, and that the child and adolescent health program is currently in the initial phase of review. Thank you very much for your time.
Thanks a lot to you, Cecilia, for the wonderful presentation and for managing to cover a lot in a short time, and really showcasing a wonderful example of Portugal, not only of the child and adolescent health program, but also a wonderful example of collaboration with other social ministries through the referral and through the extension for the early intervention program. We have a few minutes for questions or reflections for Cecilia, so please use the time. We usually run out of the time for discussion, so this time we've really tried to make sure that that you can come in as well and ask the presenter. We only have words of praise in the chat, Cecilia, but no specific questions for Portugal yet.
Thank you very much.
Or we have one question from Dr. Ronit, a message that is unfortunately not readable. It's, at least to me, comes in a strange font. So if Dr. Jakobovic wants to come in, please do. How do you deal with anti-vaxxing is the question.
Thank you very much for the question. Portugal is actually a country where the anti-vaccination movement has not, and very where vaccination is deeply rooted in community and in families. So we have vaccination rates that are extremely high, and there's a huge confidence in vaccines. Still today, so our national vaccination program has very high vaccination rates, and continues to achieve herd immunity. So I think what we have tried to do is continue to establish this as a routine, and nurses in their outpatient clinics with the families, as well as doctors, speak routinely about vaccination. And if there are pockets of population that are identified as being septic or that need further intervention, that would be something that health teams would also address. But luckily, and despite, luckily, it's not just luck, I think it's from a population awareness, vaccination is still very high. The uptake is very high in Portugal. Thank you very much for the question.
Thanks a lot, Cecilia. And we have two more questions that I hope we could merge into one. The first one is how to support vulnerable family of children with intellectual disability. And second one is if 3 ministries in SNP budget together and train the service providers together. Because I think SNP is the way of supporting vulnerable families of children with all kinds of disabilities. But maybe if you can reflect.
Yes, the SNP, so the National Intervention, the ministry that is mainly responsible, and that is the responsible ministry for SNP, is the Labor and Social Security Ministry, which is interesting. I think it's an important situation where there is they are a very invested ministry in the SNP. They allocate the resources that are necessary nationally, and so their lead is, I think, very important for the maintenance of SNP at a national level. And so teams are not all trained in together, because the interventions are very tailor-made and specific for each family, but in the domain of education, or in particular in the health domain. So training is sometimes of the whole team, and others specific from that specific ministry. But as I said, there are very asymmetries from a regional level on the uptake and the investments that SNP has.
Thanks a lot. But SNP teams are located within the healthcare. So the Ministry of Health is also a significant contributor and supporter. And Dr. Elias, also there is a question, who completes the tool on the ground?
So this tool, the Mary Sheridan questionnaire, I would assume, yes. So the Mary Sheridan questionnaire survey is performed in the outpatient clinic. So either by nurses who see children in their outpatient clinics of child and juvenile health, or by GPs or pediatricians. So at any of this level, in one of the routines, and this is of course for the well child. These are the routine appointments for the well child. If an alarm sign is identified in any of these outpatient clinics, this would be a referral would be done by the professional who performed the assessment.
Thank you so much, Cecilia. I mean, we have more questions, but we have come to we have to keep some time for the second country as well. So Cecilia, it would be wonderful if you can also provide some responses in the chat as we go, because there is a question on the standards for SNP and a lot of interest. So please continue in the chat, while with a lot of thanks for the great presentation and for the responses that you have provided. And we also want to hear from Moldova. We have two presenters that will tell us more about their experience in moving towards adolescent-friendly health system. And our first presenter is Dr. Chandra Mouli, who led the work on adolescent sexual and reproductive health and rights in the World Health Organization for 30 years. And following the retirement, he continues to learn, communicate, teach, and advise and support adolescent health work like the one in Moldova. His intervention will focus on adolescent responsive health systems, why, what, how, where, and so what. Dr. Mouli, please go ahead.
Thank you very much, and greetings, everyone. My short presentation will set the stage for a presentation by my good friend and longtime collaborator, Galina Lesko, one of my heroes in this field, who will speak to the details in Moldova. In my presentation, as the moderator kindly said, I'm going to answer these 5 questions. Next slide, please. First question is why? Health workers have an important role to play in helping adolescents stay well and helping them get back to good health if they are ill or injured. We heard from the presentation in Portugal about the systems in place to try to address this. Adolescents in many places face barriers in obtaining the health services they need. Some of these barriers are for children and adults and for all segments of the population. Others are specific to adolescents. There are efforts underway to make health services adolescent-friendly. These are limited in scope. They address some issues, they address some groups, but overall, there are many barriers to the provision and uptake of health services by adolescents. So while some adolescents can benefit, large proportions of adolescents in countries do not. That's why we want a whole of system approach. Next slide, please. So what are we talking about when we talk about adolescent responsive health systems? From an adolescent's perspective, a 16-year-old girl who comes to a clinic and wants emergency contraception, or a 19-year-old boy who feels anxious and wants care, there's no difference. There's no difference. An adolescent-friendly service can provide the same service, but the issue is we want this not just for small numbers of privileged adolescents in one part of one city, often the capital city, but we want these young people across a large country, including in poorer areas, including in rural areas, to get these services. So as countries strengthen universal health coverage, there are growing calls to ensure that adolescents are not left behind. And this can be done by deliberately ensuring that national health systems address and respond to adolescents' needs and problems. Next slide, please. The how. Research studies and program and project evaluations have identified many key attributes of adolescent-friendly health services. The main focus has been on sexual and reproductive health. A growing number of countries are integrating these proven attributes into national health systems. So that's really what this means. It means taking the health system's building blocks and then integrating the proven elements into those health system building blocks, as you will hear from Galina in a few minutes. Next slide, please. Where is action needed? Strong leadership and governance are needed at the national level, and that's one of the great beauties of the Moldova example. How they have addressed financing, for instance, at the national level. But they don't stop with action at the national level. They work at the provincial and the district level. Working relationships are needed between different departments in health, for example, between mental health and reproductive health, between different levels of care, and between health systems and other systems, as Sophie Julian said in her introductory comments. And while the focus should be on the government sector, again, as the speaker from Portugal pointed out, there's a big increase in private sector involvement, and they absolutely need to be addressed moving forward. Next slide, please. This is my last slide. So what? So what's the value of an adolescent responsive health system? I'm going to post in the chat a YouTube video presentation. A journal paper is just about to come out, which includes the Moldova case study. What it shows is that adolescent responsive health systems are inclusive. Adolescents, including those who are marginalized, can be reached with quality services. They are efficient in the context of shrinking resources. They are making existing systems responsive is better economically than having parallel systems for adolescents. And they enhance health. And as you will see from Galina's presentations, although the focus of Moldova started with sexual and reproductive health, now we see benefits in mental health, including suicide prevention. So thank you, Madam Chair, and over to you, and then over to my friend Galina.
Thank you
Namaste.
so much, Dr. Molly, for really making the excellent job in laying the foundation. And for Dr. Galina Lesko, who is the head of the National Resource Center in Youth-Friendly Health Services, Neovita, and executive president of the Health for Youth Association from Chisinau, Republic of Moldova. Dr. Lesko, please go ahead.
Hello, everybody. Dear Alexandra, dear Chandra, dear all, thank you so much for this opportunity to share our experience. And taking this opportunity also, I want to start with my gratitude to long-term support, technical support from WHO, personally from Chandra, Susan, and many people from different part of the world, because we tried and learn a lot from best evidences and best experience in the world. It's a voyage, it's a long-term intervention in our country. It's over the 20 years. Do you see well my okay? And now some concrete moment from Moldova. A few words about Moldova context. If to refer to demography, we are in a very deep demographical crisis, especially due to working migration. You can see that during the last over the 20 years, 30 years, our population decreased twice. And of course, also parallel, it's aging of population. And now our young people represent 1/3 of our population, and 11% are adolescent itself. And of course, like in many countries in the region, almost of case of mortality cases in this adolescent age are due to avoidable causes: trauma, accident, intoxication, suicide. Suicide rate have decreasing some, but reaction it's respond very often to some crisis, like was initiation of COVID crisis, and last year something in girls, but we try to keep it. And also, if to discuss about reproductive health and adolescent pregnancy, it's very important to mention. And today was already highlighted risk for vulnerable group, and in our case, almost of cases of adolescent pregnancy happen in adolescent young girls from rural area, and STI high rates, syphilis, gonorrhea, it's quite much higher in adolescent age than in total population. And last year during the pandemic and humanitarian crisis, it's increasing. Adolescent fertility rate, in spite of fact what was very significant decreasing last decade, but remain higher than average on European region. And we have a problem with nutrition on near the 1/3 of adolescent, and also abuse. It's quite a different form of abuse, starting from school, bullying, internet bullying, cyberbullying, another form of abuse, reach at least 1/3 of young people. And also our determinant factor have many risks, like this migration determine or contribute what near the 1/3 of adolescent what they have at least one parent working abroad, and near the 7% both. And comprehensive health education, it's just partially covered by school, and of course ongoing social and humanitarian crisis. And in response to this problem in Moldova was developed, as in many countries in general, youth-friendly health services since beginning of 2000. And we started from few pilot youth-friendly centers, and now we have full network of youth-friendly clinics, youth clinic, but also we introduce, this is large packet of services, but also we introduce, and it's in process of introducing basic package of friendly approach that it's introducing in primary health care and other different services, but mainly at this moment it's in for family doctor, family nurses, and other specialists. And you can see what is covered by services all country, and what services are focused in 7 priority problem for adolescent health in Moldova. Mostly these problems are related to area where adolescents have a huge problem from one hand, but from other hand more challenges to reach ordinary services. And of course this is problem related to sexual and reproductive health, what you can see, mental health and psychological well-being, different form of violence, nutritional disorders, and particularity of youth-friendly services, especially provided when it's provision of a full package of services. It's 2 main direction, consultative activity, but focused on particularity of age with a big behavioral change component, consultation component, motivational interview, etc. On multidisciplinary team like doctor, psychologist, social worker, team of volunteers, and also very important integration of consultative work with informational and educational and organizational activity at the national level and at the local level too. And you can see that we have different type of educational program for adolescents, especially through the peer-to-peer approach, and we have a very strong youth clinic volunteers network. Also we have program for parental education of adolescent and pre-adolescent. We have a program for collaborative learning with other specialists. We have online consultation, information, and of course doing research, advocacy, and this is mainly coordinated by our resource center at the national level. This is a short presentation, and here you can see what we started from 2002. It's not in this slide, but few centers. We have in 2011 few pilot clinics, and started a big project of scaling up, supported by international partners, especially Swiss Cooperation Office, UNICEF, etc. And now and started from coverage of these services in 5%, and now last year we have coverage of 38% of 10-24 years old population by this comprehensive package of services. But this is documented by youth-friendly clinics. It's not documented all adolescent that was consulted by family doctor, just more comprehensive services. And of course our work was done in very comprehensive integrated way, and was done action on all building block of health system at the all level, and this mean what on leadership and governance, and it's a full list on each block, but I will mention only one or two main action what was done during this year in leadership and governance. I want to mention what was a lot of work in normative framework revision, including elaboration of quality standard for user-friendly services, normative norm and regulation, and this process was done and continue to be done in with the involvement of young people on financing block. Mention it's a big achievement of our country, what since 2000, even 2008, our medical insurance company started to finance this service. I want to mention here what youth-friendly clinics, what now are not separate clinic or parallel to system. They are actually a subdivision of existing primary health care institution and work like an open door in the system for adolescent and with staff that already existed in primary health care institution. And all this process of it's in continuous improvement of financing based on few economical evaluation, and now with support of WHO, it's occurring last one. And on services delivery, as I mentioned, we have a very problem-solving approach. It's result-oriented, as I mentioned before, and we have basic package of services, enlarged package of services, and we have work also in some at different level in capacity building of our human resources in the country, started with list of competencies and basic training program, and also we work together with Ministry of Medical University and was reviewed university curricula, and especially in pediatrician residential course, in family medicine residential course. It's a postgraduate curricula, have a course in adolescent health. We also in working place implement collaborative learning sessions, supervision, and even today I want to mention that I am not alone in this room. We overlap our meeting with our ordinary supervision meeting with Chief of Youth-Friendly Services, and together with me in this room sit my colleagues, 31 person, what are looking, and I'm very proud, and thank you very much. All applause for you, and you can hear all we are together with a great team, and it's not possible to do alone all this great job. Also, of course, we base a lot on and appreciate very much our evidences, and it's improve a little bit health statistics. I want to mention especially we developed a separate informational system for youth clinic, but it's in the confidential way. It's a lot of data, and also we use behavioral study, coverage study, economical evaluation, as I mentioned before. Few examples just, and on commodity and logistic, what help us to offer really services, and my colleagues can compare when we started only with consultation, and now we really solve problem. And you can see a few of them, but I want to mention what all our services started with even by family doctor, youth-friendly services, and other services have already full, quite full comprehensive list of contraceptive, what it's provided free of charge for adolescent. Also, we have this.
Galina, I'm sorry to urge you to move a little faster.
Yes,
there are many
thank
important
you.
messages you have at the end. I don't want them to be lost.
Yeah, it's yeah, this is just shortly, and you can see what I mentioned it already, what now was the main idea to assure sustainability, what these services, it's part of existing primary health care. It's financed by National Medical Insurance Insurance Campaign, have had, especially in previous time, a good strategic support from National Program and Strategy, and had very good and huge support from development partners, and you can see our some result, and just few trends, not figures. You can see in this up to slides a tendency how increase distribution of contraceptive and youth-friendly services. You can see in this right part increasing of use of contraceptive among 15 years old adolescent, sexuality active adolescent, and as a result you can see decreasing, very impressive decreasing of all pregnancy rate in adolescent births, abortion, and all this indicator. You can see our work in the STI and HIV. You can see increasing of HIV rapid test and youth-friendly services, including through the UK mobile. And we can keep in under the control HIV. This is 2 below line. It's not increasing comparing with the older population, but we have an increasing of syphilis in last year due to this crisis and a big mobilization of population. But we work a lot, adjust at least to detect yearly and to prevent mother-child transmission. The same, it's suicide. We developed new services online, support line, 24 hours chat, online counseling, and we had decreasing suicide number among adolescents and increasing on pandemic crisis. And last year, it's a new challenge, increasing in girl. We should clarify what it's called. And as a final stage, I want to mention 3 main points to move from a youth-friendly health centers approach to a health system responsive health system approach. Maybe first of all, it's very important to create in the country of motivation core initiative group of professionals. But I had our colleagues around me, and we have a resource center in the country. And of course, to do action in all of existing health system blocks, not in just one episode, one training, one document. And of course, this is not only one step, one action. It's need to keep moving and adapt permanently to the context. The realization, we are just in the way, we are in process. We need to improve our school health services, our hospital care, and many other things. But we are in process, and we are proud of already achieved result. And I want to say what it's published by WHO last year. You can to read more. And I want to thank very much all of my colleagues, all person who was involved in this process. And first of all, our volunteers who are very proactive and participate very actively as advocator in for new strategy in European region for adolescent and child health. And we are looking very much for such strategy. It's very needed for us to have to move forward. Thank you very much for all and for this opportunity. And I am looking for your question if you had it.
Thanks a lot, Galina. Impressive work and impressive commitment from Moldova, and congratulations for all the progress that you have evidently made across time with increasing coverage with the services and reaching more and more adolescents. So it is really very, very impressive what we heard. And I think that we can bring together both presenters, if possible, on the screen. We have the first question for you coming in relation to the Ukraine crisis and displacement, and if Moldova, how does Moldova address the mental health needs of war-affected children from Ukraine? And are there any best practices?
Yeah.
And do you collaborate with Ukrainian colleagues?
Thank you for this question. Even since beginning first day of humanitarian crisis, all our centers and we in Chisinau and in the district, we was very involved, and there was a lot of outreach work. We go on the center of temporary placement of refugee since beginning, since first day, and work with family, with mother and with adolescent, with some humanitarian help and with some information informational healthcare. In the time was developed some informational tips for parents with we collaborate with many parenthood with many global parenting organization, and even some tips or booklet for parents, and also a lot of health services. In the time we developed and now piloting 5 car mobile services. And one of the point of work of these services is most vulnerable adolescent in refugee campus, in village area, in the now it's summer camp for kids where exist continue to be placed or to have displacement person from Ukraine. For us, it's not a problem because we doesn't have language barrier, because all of us speak Russian, and it's not a problem to offer and to not have any barrier. And we are very glad that we obtained this possibility, and yes, did a lot and continue to do.
Thanks a lot. I'm running with questions because of the shortness of time. And the second one is, what are you doing in Moldova regarding health literacy of adolescents?
It's a complex. Of course, we're doing something in school too, and it's increasing a lot what it's in doing. And Moldova, we perform few times CERAT evaluation of our program, what it's doing in the school, because there is few mandatory discipline who address some issues of adolescent health. And now even we had a common initiative, latest one, together with Ministry of Education. They have an initiative to have instruction how to prevent adolescent early pregnancy in the school, and we have a common approach through the video, through the visit to youth friendly. It's a mandatory curricula, and also it exists extracurricular activity where are involved very much our clinics, and we also support this initiative of health promoting school, and also this peer program. And we have few main direction as youth-friendly services. First of all, advocation. For second one, it's training of responsibility from educational sector for curricula and teachers, school nurses. And also we have our informational hours in school, or vice versa. School children, adolescent come in visit to youth clinic. Other one, it's peer program. Our volunteers who are trained as a peer trainers, they go into school and perform peer-to-peer education. Another one, we use very actively online, all online tools, and started with short reels and finalize with some more longer video or etc.
Thank you. And I've just last question is, if you have the special set of indicators that you use to evaluate the current economic impact of the youth-friendly health services?
Yes, we use different approach in economical evaluation. First of all, first one in 2011 was evaluated together with WHO, and the exist international publication article you could paper could read. And now together with WHO, it's a new approach, a new tool, and we pilot this year with some volume indicator, resource indicator, process indicator, and we'll see how we work. We hope very much that will be very useful tool for improve financing mechanism.
And we've seen that you, Dr. Chandra, included some links into the chat.
Add a quick word. One of the points that Galina just made is how hard they worked and strategically they worked to make sure that youth-friendly health services was integrated in the National Health Insurance Scheme. I'm going to put an article in the chat. That's something anyone is further interested, please reach out to Galina, because it was a long-term strategy. The second one that I just put was they've gone away from training. Training on its own is of very limited value. And what they have done is they've taken training and placed training within a broader package of evidence-based performance improvement approaches, so that they don't only learn from a teacher, but they learn very much from each other to solve problems and to improve quality. So we're thinking not of training, but of performance of health workers. And so training is only one small part of a strategy to improve performance.
Thank you so much. I mean, we've had excellent presenters today, and the level of engagement and question proves that. We have heard about health system engagement, but also very important collaboration with other sectors, with other systems in both countries. And I hope that the participants have really found it interesting, useful, inspiring to do something in their own context. I sincerely thank all the speakers, and would like to invite Dr. João Breda, who is the head of the WHO Quality of Care Office in Athens, to provide some concluding remarks and close the webinar.
Would you like, Alex, to present the last slide before John comes for the final reflections?
Yes, if Jen, you can share. You know that we are referring to this as a series of webinars. This is the second one. We have one more that is planned on the 16th of September, and that will go into the implementation challenges and approaches. We hope that by running all of these discussions, once the strategy is adopted in October, we will be ready to run and implement and do whatever we can. So we are kindly asking you to note it in your calendars and to be available and with us on the 16th. Of course, we will send reminders and invitations. And we also invite you to subscribe to the newsletter that you can access through the code or through the links that Jen has kindly shared in the chat. That means that you will be receiving from us the updates, different resources and materials, as well as all the materials from this webinar. So we're also looking forward to your participation on the 16th. We will try to provide some nice examples of countries that already had a good experience with the implementation of the child and adolescent health policies. We will also ensure that we have youth with us and discuss how can youth support also implementation of the strategy. So, Sophie, do we know if João is with us?
He has been the whole time with us because
now we have a problem with the connection.
And I know it's about the connection. I cannot reach him either, but I know I had a very nice comments on the two last presenters as we were listening them. So I think we can close the webinar. I would like to echo your last words, Alex, and to thank the two countries who have presented for these very brilliant and inspirational examples in their own countries. So hopefully this is also moved in the rest of the region. So thank you all for participating, and we very much look forward to welcome you in the third webinar in September, after maybe an August break for some of you. Thank you all.
Thanks a lot, Sophie. Thanks a lot to all the participants, and see you in September.